Welcome back, everyone. Millions of Americans are living with type 1 diabetes, a chronic autoimmune disorder that requires daily injections and constant monitoring. But a clinical trial is looking to change the game through a new treatment method. And joining us today to talk all about that is Doctor Jean Chen with Texas Diabetes Endocrinology and one of her patients, Paige Newman. So thank you both for joining me today.
Thank you.
We really appreciate it. So talk to us a little bit. I think everyone is probably loosely familiar with diabetes, but give us a little bit more of a real definition of what it is, what causes it, and how does it impact patients like you, Paige?
Well, type 1 diabetes is an autoimmune disorder in which, unfortunately, the immune system doesn't recognize certain cells within our pancreas, which are supposed to make insulin. Insulin tells our body to absorb glucose from the bloodstream and use it for energy or store it as fat. And unfortunately, if we don't get that signal, the sugars start to rise. And our blood vessels in our body are really not supposed to have this level or high levels of glucose circulating around for prolonged periods of time, and so it can cause damage, especially to end organ damage like brain or the heart or the kidneys. So it is really important that we continue to find these patients who have type 1 diabetes so we can get treatment ongoing. But these clinical trials are really, really important because right now our conventional therapy is really insulin, which Paige is very familiar with. But we're trying to look outside of conventional therapy and give this community some hope that we're looking for ways to prevent continued damage or preserve what insulin function they can have.
Yeah, I want to circle back to the clinical trial in a moment, but Paige, I want to bring you in. For folks who aren't living with this every day, give us a peek into how it impacts your life.
It's a constant struggle. It's every minute of every day. You never do anything without thinking about it. I do multiple daily injections, so I take a minimum of 8 injections a day. I have to check my blood sugar before I eat, before I exercise, before I drive my car. You want to make sure that your number is in a safe range. So you're constantly thinking about, am I rising, am I falling? Do I have a snack with me in case one of those things is happening? So it's a never-ending thought in your head.
Yeah, we appreciate you opening up and sharing about it. It helps all of us get a better understanding of why treatments like you described are so important in these clinical trials. So let's get into it. Talk about this clinical trial. How will it work? What is it doing?
So right now, this clinical trial is looking for patients who unfortunately has been diagnosed with type 1 diabetes unexpectedly. So still pretty early stage, and what this is introducing almost kind of like a nanoparticle that has some immune modulating therapies that hopefully again gets the immune system to re-recognize those beta cells or those certain insulin producing cells in the pancreas, so the immune system does not continue to attack those beta cells and retain their insulin function.
And what are you looking for in the trial? What might be metrics of success?
Really, if patients' blood sugars are staying stable, if they're not requiring insulin or as much insulin, that's usually a good sign that they're starting to continue to produce insulin on their own.
For someone who, like you said, is constantly checking those levels, what would that be like to see results like that?
I said to Dr. Chen, I thought I didn't qualify. They're looking for people that are in early stages of diagnosis, and I'm about 20 years in, so it's a little too late for me. I would take a month of that. I would take a year of it. A lifetime would be incredible, but it can be exhausting, and to just know that maybe there's a treatment that could help eliminate some of that mental load would be wonderful.
Yeah, some hope for people. What are you really looking for? There are some limitations on this clinical trial that would be important for people at home to know if they're interested.
Again, we are looking for patients who are newly diagnosed, and so within the last 6 months of diagnosis. And honestly, the inclusion criteria is quite not very strict. We are looking for all types. So everyone that thinks that they could benefit, please contact us. We are happy to talk to you about it. And it's always good to have a database of patients who are interested in research, because this is one study, but we are always looking and trying to be innovative and continue to have other future studies that they might qualify for.
Yeah, I want to zoom out just a little before we let you go. What is the biggest struggle in trying to move forward some of these advancements? And you've given a lot of hope with this clinical trial, so any hope for people at home who are thinking, man, this is such a hard thing to deal with on a daily basis?
I think in general, just kind of keep that message that we are still looking. We hope one day there is a cure for type 1 for even those that have been around, had it for 20 years. I think the hardest part is we are still looking at the underlying cause, what triggers this autoimmunity. That's sometimes really difficult to identify for every single patient. So I think it's just trying to find one treatment option that can be applicable to everyone. So.
More time, more study as well. Well, just last question here for folks who are interested and think they may qualify, where should they go?
So please contact look up our website at Texas Diabetes and Endocrinology. There is a link for our research studies and also contact phone number and email.
Wonderful. We'll work to get that on our website, KXAN.com as well. But thank you both for coming to share your experience, and we hope to follow up with you once the clinical trial is up and running and hopefully has some results as well.
Absolutely.
Thanks for being here.